Society of Hospital Medicine designation. You may be closer than you think. I'm Deborah Beach, and I manage the Fellows program for SHM. We're probably going to just give another couple of minutes before we actually start the presentation to allow a few more folks to join us. Good afternoon. We're ready to start the webinar now. Thank you all for attending. To repeat, this is the Society of Hospital Medicine, Fellows designations, and hopefully you may be closer than you think. We're going to start today by going through just a little bit of the history of the Fellows program briefly, and then we're going to get to the, I think, relevant part of how we can help you, which is walking through the online application. And we'll close with comments from two guest speakers who are currently fellow in hospital medicine and senior fellow in hospital medicine. I'm the moderator. Again, my name is Deborah Beach. I manage the Fellows program for SHM, and I've managed this program now for a little over 3 years. Our first guest will be Kenrick Maynor, who is the Director of Hospitalist Medicine Services at Geisinger Health System, which is in northeastern Pennsylvania, and Lorraine Britting, Clinical Manager of Nurse Practitioners in Cardiology Medicine at Beth Israel Deaconess Medical Center, which is in Massachusetts. Sorry. Brookline, Massachusetts. Excuse me. A little bit of housekeeping. If you would like to ask a question, just type your question in the question box, which is to the right of your GoToWebinar screen, and we'll either stop and read the question and respond or save it till the end of the presentation. Just a few facts about the Fellows program. It's been in existence since 2009, and currently we have 955 Fellows in hospital medicine. We have 365 Senior Fellows. We have 16 Masters, which is not something you can apply for, but is something that you are nominated for. It's a little bit separate from the process, but it's part of the Fellows program. Since we started including all of the people who take care of hospitalized patients in this particular designation, we opened in 2012, and we have 4 practice administrators, of which we have 19, nurse practitioners, of which we have 10, and physician assistants, of which we have 3. What this represents right now is about 40% of our members who are eligible, or 40% of our eligible members, I should say, are fellows, and only 25% are senior fellows. We are hoping that as time goes on, we can bring those numbers to about 40 to 50% of eligible members, because we find that the designation really lends a differentiation and an additional credibility within the profession that we believe by practicing the core values and demonstrating those, we're able to really set our hospitalists apart. So that's something we want to encourage and support. At this point, we're going to, with the help of Chris Monroe, who manages from the IT side of the application, walk through the application process. This process, when we first started the Fellows Program, was completely on paper. There was a paper application that was completed. There were separate reference applications that were also sent in separately. And there was quite a bit of paper to manage and quite a bit of information that was increasingly difficult to capture and organize. So the decision was made to put the entire application process online. And that led us to what we have today, which is found on our website. When you click on the Members section and then click Fellows, you will come to the pages that allow you to apply for Fellows.
Okay, so starting from the website here, I have already logged in. But other than that, you would just start at Membership, Fellows Program, and Apply Now. From within this page, you then have to decide which type of fellowship you'd like to apply for. For this demo, we'll go with the first one, physician. I'm going to check that. Gives you some other information about criteria. If you were interested, we have everything online. See ahead of time before you decide to apply. If you want to see if you're going to make the criteria or not, you can download the PDFs and view the questions that we're going to be asking you. Once you've decided that you're going to go ahead and apply, accept, and start the process. So there are 5 sections in here. You want to be able to check off each of the 5 sections and then move on to your payments. So the first section is really just a review of the information that we have on file for you. Okay, so in these next 2 sections, you're actually trying to come up with a certain amount of points. So you have to generate a certain amount of points in total. So as you're entering them, it will tally the points for you. And then once you have accumulated enough points in a given section, you would move on from here to the next one. So I'm just going to go ahead and complete these 2. And then you move on to the sponsor endorsement area. Now in here is where you're going to provide us the information for who you would like to use as an endorsement. Once you enter this information, an email will be sent out to them. They will click on it. It will lead them to a endorsement area where they will leave you an endorsement that we will be able to read later. So I'm just going to fill this in.
It's important to note here that your endorser does not have to be a fellow in hospital medicine, but merely has to be an active member of SHM. That's a distinction that people don't always draw. So it just needs to be someone who's currently a member of SHM and who knows your work, obviously.
This fifth section is just an agreement. Something to note, if you start to fill this out and come back later to finish or make payment, this will uncheck, so you will have to go back and agree to this each time before you actually finish it. So from this point, we've filled everything in, so your application will be pending receipt and your endorsement. So from here, I'm going to go in to make my payments. Keep in mind that it does mention shipment information. You can just ignore this. We're not actually going to ship anything to you. It's just something that we have in here. So I won't bother with the credit card information, but once you went in, fill this information out, and checked out, you would then be done with our process, and we would only be waiting for your sponsor endorsements.
The fee for Fellows application is $125, and it's an administrative fee. For Senior Fellow, it's $150 administrative fee. You would receive, as Chris mentioned, a receipt or a confirmation that you've completed your portion of the application and paid. You will receive a confirmation when your endorsers have both submitted their endorsements back to us, and then you'll receive a final confirmation that everything is complete and ready to be reviewed. I think it's important to note, too, that we keep the applications on file up until the deadline. In this case, it's January 9, 2015. And after that time, if the application is not completed or not accepted for any reason, it would be necessary to start again for the next time that you wish to apply. We don't retain those applications from year to year. So that's just something else good. People do tend sometimes to start working on them, save them to come back, and then sometimes are not able to complete them for whatever reason. So those are discarded, and we start fresh with each class year. I think the endorsement piece is the biggest piece I'd like to really stress, because a lot of questions come in as to how their endorsers are going to submit, and does the candidate need to send anything to the endorser? Do we reach out to the endorser? And the answer is just that. As soon as you put your endorser's name and contact information in, the rest of it is they are reached out to automatically through an email. They submit back through an email, and the endorsement is attached to the application, all without any paper being involved. It's all completely online process. Pause here for questions. If anybody sees it or hears anything that they weren't aware of or find needs to be clarified in any way. Yes, to submit a question, you simply type your question in the box to the right of the screen. Okay, and here we have a question. What is in the endorsement email? We have a pre-formulated set of questions, and it's a PDF. It's a writable PDF that you respond to each of those questions. And it's about the length of time you've known or worked with the candidate, the quality of the candidate's work and commitment. It's a subjective statement, but it also focuses on the core values that we talk about in the application, which are related to quality improvement and leadership. It's not a long form, but it gives you also a chance to write in your own, whatever you'd like to say, free form about the candidate. The next question: must you be a fellow prior to applying for Senior Fellow? No, you do not have to. It's not sequential. There is a pretty substantive difference in the Senior Fellow application in that it has an entire section on lifelong learning, which requires a good many more points. The difference really is that to be a Senior Fellow candidate, you have to have been a member of SHM for at least 5 years. And for the Fellows candidate, you have to be a member at least for 3 years. Okay, next question. Is there a time limit on how far back in your career you can claim points in each area? No, there's not, as long as you were a practicing hospitalist at the time. is there a requirement of how many national meetings one has attended? Whenever you see at the beginning of the application, before you actually enter the application, it will ask how many meetings, certain designated meetings that we have included you've attended. The requirement, the baseline requirement, is at least one annual meeting, SHM annual meeting. And then the second meeting you're asked to have can either be a second annual meeting, or it can be one of about 6 designated meetings, which are regional hospitalist meetings, such as the meeting at UCSF, or Midwestern Hospital Medicine, or Southern Hospital Medicine. And again, there's a list of those. Okay. Does the qualification of the endorser have any impact? No, not really. We look at just whether the person is a practicing hospitalist, a member of SHM, and what their relationship is, with the candidate, how they would know about the quality of that person's work. Other than needing to be an SHM member in good standing, is that part of, I'm sorry, was that part of it? I'm sorry, I misread that. No, just what I just described. Any other questions? One more thing I wanted to add that wasn't on the in the process is there a renewal of this designation? No, there's not. If at any time a fellow either does not maintain his or her membership or has any kind of disciplinary action, then their fellow status is revoked. But other than that, there is no need to reapply or to refresh the fellow's status. Quick notes on the review process. The review process is done, early review is done in September, and that's just anyone who has completed all of their application requirements by September can be reviewed and will be notified in October. However, the final deadline for each class year is January, this coming year it happens to be January 9, 2015. And that deadline allows us about 2 weeks or so to review the applications, make the determinations, and then people are notified in February and early March prior to the annual meeting, in this case coming up in Washington, or in National Harbor at the end of March 2015. The induction for all new fellows takes place at the annual meetings each year. Any other criteria apart from being involved in a committee? What if you were not on any hospital committee? I would just encourage you to look at the PDF that shows all of the different ways that you can demonstrate leadership. It says work group or task force. It does not have to be a committee, but it does have to be a group of people, or an instance in which you are leading a group of people or an effort to affect change, affect improvement, that sort of thing. Okay. Okay, if there aren't any other questions right at this moment, we'll just move on to our guest. Dr. Maynor, welcome.
Thank you.
I would like to talk with you just a little bit, and for the benefit of our attendees at the webinar, about your experience as an SHM Fellow.
Sure.
What led you to apply, and then what kinds of things have you seen as a result of being an FHM Fellow?
Sure. I applied approximately 2 years ago, and I did so because I believed and still do that it does, I think, mark an area of distinction from your personal career and the trajectory of that career in being committed to hospitalist medicine. And I think within that, I think you're sub-selecting yourself as far as a pretty small group of leaders within medicine that primarily do hospitalist medicine. I think the other piece that I wanted to be a part of that I think has been very valuable for me as well is the network of the Fellows program, and being able to learn to communicate, to share best practices with those fellows. You understand that going from conference to conference or from one avenue and opportunity within the society to the next, there's a pretty high yield of the fellows that attend those, and you really get to know each other fairly well, and you really get to start to share those practices and those differences that are unique in the field of hospitalist medicine. I've used that SHM designation fairly readily now within my professional career, and I think it's really acknowledged and appreciated both from an administrative standpoint by clinical and non-clinical leaders as well. And I think what it automatically does is hone them into the fact that I'm very serious about this as a career, and I think it provokes initial discussion for those that may be unfamiliar with not only hospitalist medicine, but the society and its goals and aims, which is increasingly becoming less so because I think the society has done a really good job of being very influential within the sphere of medicine. And then I think the other piece that I've seen personally and professionally is that credibility to other medical specialties, as well as regionally within our own department. As we've gained additional traction and a critical mass of fellows, even with our own hospice department, I think it's led to a higher regard of our department, within the Geisinger health system, for example. And I've also used it from a leadership standpoint as a milestone, if you will, for mentorship and professional growth. So within the first year or so, after a new hospitalist has come into our system, and we're sitting down and doing annual reviews of what their professional and personal goals are, I challenged them to really look at the criteria that we've set forth within the Society of Hospitalist Medicine for the Fellow designation. And I say, if we're doing these things and I'm helping you to get to that point to be successful in becoming a fellow, then I think that's one more piece of professional development that we've been successful in guiding you and continuing to support you in a career within hospitalist medicine. So we've really tried to incorporate the Fellows designation into our mentoring process. So it's multifactorial, to be honest with you, but it's really, I think, been a very positive for me personally, professionally, and in my group's development.
Thank you.
The other piece that I just want to say is that I've also really enjoyed and I've really appreciated about the society is their inclusiveness for all of the health professionals that care for patients in regard to hospitalist medicine. So we do share within our system at Geisinger many nurse practitioners and physician assistants. And so with those advanced practitioners, again, I think it's opened up the scope of us all being on the same team, all working together towards the same goals professionally. And I've really actively, again, encouraged them to join the society, as well as when they get that experience underneath their belt, now apply for Fellows designation.
Thank you very much, and that's a really nice introduction for Lorraine Britting, who is our second speaker, who has achieved the status of Senior Fellow in Hospital Medicine. Lorraine?
Yes, thank you for the opportunity, Deborah. And as far as answering the question about why I applied, I'd really like to echo what Kenrick had said about the Society of Hospital Medicine being the only medical society that I know of that treats NPs and PAs as an equal member. A lot of the other societies treat us as an associate status or a junior status. But there's something as known as the Big Tent philosophy at SHM, which that I really appreciate, and a lot of my fellow nurse practitioners appreciate. So one of the biggest reasons that I applied for Senior Fellow was because I could, and because it was a recognition of all that I had done in hospital medicine. And it's really nice that I was able to earn the same type of recognition and rewards that my fellow physicians were able to do, since we work alongside each other. And additionally, I really liked the Senior Fellow designation. It is a lot more points that you need, but if you start to add up all the things that you do in hospital medicine, all the things that you do for your job, things that you do for SHM once you start to become more involved, there's a lot of different ways to get those points. You don't need to be the director of a program, though I'm sure that's very helpful. But you can have all sorts of different roles is within your hospital medicine program and get enough points to be a senior fellow. I started the senior fellow application right away and was really pleased to see after working for, I think it was about 7 or 8 years, that I had enough points to be senior fellow. So I started right off the bat and applied for that first. As far as how it's helped my job here and my career, I can't say that it's led to anything that I could point to in a concrete way. That hasn't led to a promotion. It hasn't led to any change in what I'm doing. However, I think it has helped my credibility within my group and within everyone that I work with. I think I work in a teaching hospital, and I work with a team of residents and interns and medical students, and a lot of them are just hearing about SHM. They're just thinking about a career in hospital medicine, and I wear a pin that I got on my lab coat, and they see the pin, and they ask me what it is, and it sparks a very nice conversation about my career, about SHM, and what they're thinking about as far as their career. I think there's a lot of very small things that you do every day that really add up. And when I was filling out the form, the first thought was, wow, I've really been busy. And there's a lot of things that I can put down here that I hadn't really thought about in a while. And two, I've really done more than I thought, and this adds up to a career, not just a job, not just something you go in and you do. It's really, it's a career that you have with a purpose and a forward-thinking type of attitude that SHM really helps you to clarify and helps you to work on. I'm dating myself a little bit, but I've been working in hospitals for almost 30 years, and I think a large part of being successful is hard work, but I think it's also saying yes to opportunities. And if you have an opportunity to do something that's out of your comfort zone or to do something that's a little bit different, you really should take the opportunity and do it because, as Kendrick said, you never know how this is going to help you networking. You never know how this is going to lead to a conversation in the Fellows Lounge at SHM that really makes a difference and gets you involved in something else or really helps you with a problem that you're having at your own hospital. And you never know where your career can go. And this is just a really great way to advance it.
Thank you. Any questions at all? We're open for questions. And remember that if something comes to you afterward, it's impossible to cover every question all the time in one short time frame. So I really invite you to come to our website or reach out to me personally. This is a very high-touch and personalized program, which simply means that you do have one person you can always talk to if you have additional questions or if you run into problems, so that you're not kind of left out there in virtual space, and you'll have a point person here to help you walk you through the process or help unstick anything that might get stuck. I'm not seeing any other questions. Oh, here's a question today. I missed the initial part. Where could I find the point criteria? Okay, that's at our website. If you go to the link that's right up there on the screen right now, you'll be able to go under check Fellows section, and it will show you the application, the requirements, and also there will be PDFs that will match whatever category or area that you're looking at, whether it's Fellow, Senior Fellow, excuse me, nurse practitioner, physician assistant, and you'll be able to look at those points requirements before you start to complete your application. I see another question. Are the requirements for endorsement the same as those for Fellows designation? No, the requirement is simply that the endorser is a member and has worked with the candidate or is knowledgeable about the candidate's work. Those are the only requirements. Another question, how do you find out how long you've been an SHM member if you don't remember? You can check, just call our main number or check with me, and we can look that up for you in our database and let you know exactly how long you've been a member. And just to clarify too, up until just this year, you had to be a member for 3 or 5 consecutive years. But now we have decided that that's just going to be 3 or 5 total years. So it doesn't matter if they're consecutive or not, if there's been a break in membership somewhere along the line. As long as your number of years adds up to 3, you're fine. And up on the screen right now, we have the location for the different PDFs. How long do you have to be a member? 3 years for Fellow and 5 years for Senior Fellow. Do I need to take any exam other than board certification? No, you do not. For future questions, again, I refer you to the website or to my email, and also that this webinar has been recorded and will be posted on our website so that whenever you have a minute, you'd like to look things up, you have on-demand viewing of this information. So you have that resource, you have myself, and you have our website, and all are ready to help you and encourage you as you work on having this designation. We do find, as I said before, that it is a nice distinguisher for you within your career, and it differentiates you from other people practicing in the field of hospital medicine. That really concludes our presentation for the day, and I'd love to thank our speakers, both of whom are great examples of why this designation works, why it's growing really rapidly, and why it makes us stand apart as people that are really committed to quality and patient safety, not just to talking about it, but to actually living it every day in the work that we all do. Thank you.